Question 1. A phlebotomy technician is preparing to perform a venipuncture. Which of the following is the most critical step to ensure patient safety? A. Selecting the correct needle size. B. Verifying patient identification. C. Applying the tourniquet correctly. D. Explaining the procedure to the patient. Answer: B. Verifying patient identification. This question focuses on patient safety, specifically the most critical initial step in venipuncture. The most important action a phlebotomy technician must take before any procedure is to accurately verify the patient's identity using at least 2 unique identifiers, such as their full name and date of birth, and matching them to the requisition form. Failing to properly identify the patient can lead to drawing blood for the wrong person, resulting in incorrect diagnoses or treatments, which poses a severe risk to patient health. Always remember that patient identification is paramount to preventing medical errors. Question 2. Which of the following tubes is typically used for a complete blood count, CBC? A. Light blue top. B. Lavender top. C. Green top. D. Gray top. Answer: B. Lavender top. This question tests knowledge of common blood collection tubes and their associated tests. The lavender, or purple, top tube contains EDTA, ethylenediamine tetrachic acid, an anticoagulant that preserves cell morphology, making it ideal for hematology tests like the complete blood count, CBC. This additive prevents blood from clotting, allowing for accurate cell counting and differentiation. For instance, a CBC measures red blood cells, white blood cells, and platelets, all of which require the blood to remain in its liquid state. Always remember that the lavender tube is your go-to for hematology studies. Question 3. A phlebotomy technician observes a small hematoma forming at the venipuncture site during a blood draw. What should the technician do immediately? A. Apply a larger bandage. B. Discontinue the draw and apply pressure. C. Continue the draw slowly. D. Release the tourniquet and reapply. Answer: B. Discontinue the draw and apply pressure. This question addresses a common venipuncture complication and the appropriate immediate response. A hematoma, which is a localized collection of blood outside the blood vessels, indicates that blood is leaking into the surrounding tissue. If a hematoma starts to form, the phlebotomy technician must immediately remove the tourniquet and the needle, then apply firm direct pressure to the site to stop the bleeding and prevent further swelling. For example, applying pressure helps to close the damaged vessel and prevent more blood from escaping. Prompt action is crucial to minimize patient discomfort and potential complications. Question 4. What is the correct order of draw for a venipuncture procedure when collecting multiple tubes? A. Light blue, red, lavender, green. B. Blood culture, light blue, red, green, lavender. C. Green, red, lavender, light blue. D. Red, light blue, green, lavender, blood culture. Answer: B. Blood culture, light blue, red, green, lavender. This question assesses knowledge of the critical order of draw, which prevents cross-contamination of additives between tubes. The standard order of draw for multiple tubes is blood cultures, sterile, followed by light blue, coagulation, red, serum/no additive, green, heparin, and then lavender, EDTA. This sequence is designed to minimize the risk of additive carryover affecting lab results, as different additives can interfere with various tests. For instance, EDTA from a lavender tube could falsely alter coagulation test results if drawn before a light blue tube. Following the order of draw precisely ensures accurate test results. Question 5. Which of the following is the most appropriate action if a patient faints, syncope, during a blood draw? A. Finish the blood draw quickly. B. Remove the needle and tourniquet immediately, then lower the patient's head. C. Offer the patient a glass of water. D. Raise the patient's arms above their head. Answer B. Remove the needle and tourniquet immediately, then lower the patient's head. This question focuses on managing a common patient complication during venipuncture, syncope or fainting. If a patient shows signs of fainting, the phlebotomy technician's immediate priority is patient safety. This involves promptly removing the needle and tourniquet to prevent injury from a fall, then helping the patient into a position that restores blood flow to the brain, such as lowering their head between their knees or lying them flat. For example, preventing the patient from falling off the chair is critical. Always prioritize patient safety by removing the needle and positioning them safely. Question 6. A phlebotomy technician is preparing to draw blood from a patient with a known allergy to latex. Which of the following supplies should the technician ensure is used? A. Alcohol-based hand sanitizer. B. Non-latex gloves. C. Tourniquet with a metal buckle. D. Standard adhesive bandage. Answer B. Non-latex gloves. This question highlights the importance of recognizing and accommodating patient allergies to ensure safety. If a patient has a known latex allergy, all supplies that will come into contact with the patient, especially gloves, must be latex-free to prevent an allergic reaction, which can range from skin irritation to severe anaphylaxis. For instance, using latex-free gloves is a direct measure to avoid triggering an allergic response in the patient. Always confirm and accommodate patient allergies to ensure their well-being. Question 7. After collecting a blood specimen, how many times should a phlebotomy technician invert an EDTA tube, lavender top? A. 1 to 2 times. B. 3 to 4 times. C. 8 to 10 times. D. 15 to 20 times. Answer C. 8 to 10 times. This question tests knowledge of proper specimen handling, specifically the inversion of tubes. After drawing blood into an EDTA tube, it must be gently inverted 8 to 10 times to ensure proper mixing of the anticoagulant with the blood, preventing clot formation without causing hemolysis. Proper mixing ensures the integrity of the sample for accurate testing, such as a CBC. For example, if the tube isn't mixed enough, tiny clots can form, making the sample unusable for analysis. Always remember that proper inversion is crucial for accurate test results. Question 8. Which antiseptic agent is most commonly used for routine venipuncture? A. Povidone iodine. B. Chlorhexidine gluconate. C. Isopropyl alcohol. D. Benzalkonium chloride. Answer C. Isopropyl alcohol. This question asks about the standard antiseptic used for preparing the skin before routine venipuncture. Isopropyl alcohol, typically 70%, is the most commonly used antiseptic for skin preparation due to its effectiveness in killing bacteria and its rapid drying time. It helps to reduce the number of microorganisms on the skin surface, minimizing the risk of infection at the puncture site. For example, you would wipe the area with an alcohol pad in a circular motion and allow it to air dry before inserting the needle. Always allow the alcohol to air dry completely for maximum antiseptic action. Question 9. A phlebotomy technician needs to collect blood from an infant for a newborn screening test. Which site is most appropriate for a capillary puncture on an infant? A. Earlobe. B. Central arch of the foot. C. Lateral plantar surface of the heel. D. Tip of the index finger. Answer C. Lateral plantar surface of the heel. This question focuses on appropriate capillary puncture sites for infants. For infants under 12 months, the most appropriate and safest site for capillary puncture is the lateral or medial plantar surface of the heel, which is the outer or inner edge of the sole of the foot. This area has sufficient capillary beds and avoids bones and nerves, reducing the risk of injury. For instance, puncturing the central arch or fingers could damage bone or nerves in an infant. Always ensure heel sticks are performed on the outer edges of the heel to protect the baby's foot. Question 10. What is the primary purpose of a tourniquet during venipuncture? A. To prevent blood from clotting. B. To sterilize the puncture site. C. To make the veins more prominent. D. To measure blood pressure. Answer: C. To make the veins more prominent. This question tests the fundamental purpose of a tourniquet in phlebotomy. The primary function of a tourniquet is to impede venous blood flow temporarily, causing blood to pool in the veins below the tourniquet, making them engorged and more visible and palpable. This increased prominence helps the phlebotomy technician locate and access the vein more easily for a successful venipuncture. For example, a properly applied tourniquet allows you to clearly see and feel a vein that might otherwise be hard to find. Remember, the tourniquet makes veins stand out, but it should be released promptly once blood flow is established. Question 11. Which organization establishes safety standards for healthcare workplaces, including guidelines for preventing needlestick injuries? A. CDC, Centers for Disease Control and Prevention. B. FDA, Food and Drug Administration. C. OSHA, Occupational Safety and Health Administration. D. CLSI, Clinical and Laboratory Standards Institute. Answer: C. OSHA, Occupational Safety and Health Administration. This question assesses knowledge of key regulatory bodies in healthcare safety. OSHA, the Occupational Safety and Health Administration, is responsible for ensuring safe and healthful working conditions by setting and enforcing standards and by providing training, outreach, education, and assistance. They specifically mandate the use of safety-engineered devices and establish exposure control plans to prevent needlestick injuries and bloodborne pathogen exposures in healthcare settings. For example, OSHA requires employers to provide appropriate personal protective equipment, PPE, and maintain sharps disposal containers. OSHA is your go-to for workplace safety regulations. Question 12. A phlebotomy technician is preparing to perform a venipuncture on a patient with a known history of fainting during blood draws. What is the best position for this patient during the procedure? A. Sitting upright in a standard chair. B. Standing by the examination table. C. Lying down in a supine position. D. Sitting on a stool without back support. Answer: C. Lying down in a supine position. This question addresses a specific patient safety consideration for individuals prone to fainting. For patients with a history of syncope, positioning them in a supine, lying flat on their back, or semi-Fowler's position, reclined with feet elevated, is the safest approach. This position helps prevent injury if they do faint by reducing the risk of falling and aiding blood flow to the brain. For instance, if a patient faints while lying down, they are less likely to injure themselves from a fall. Always prioritize patient safety by having them lie down if they have a history of fainting. Question 13. Which of the following actions best describes proper hand hygiene for a phlebotomy technician between patients? A. Wearing sterile gloves continuously. B. Washing hands with soap and water or using an alcohol-based hand rub. C. Rinsing hands with water only. D. Wiping hands with a dry cloth. Answer: B. Washing hands with soap and water or using an alcohol-based hand rub. This question emphasizes the crucial role of hand hygiene in infection control. The most effective and appropriate method for hand hygiene between patients is either washing hands thoroughly with soap and water for at least 20 seconds, especially if hands are visibly soiled, or using an alcohol-based hand rub when hands are not visibly dirty. This practice significantly reduces the transmission of microorganisms and prevents healthcare-associated infections. For example, performing hand hygiene before and after every patient contact breaks the chain of infection. Always remember that proper hand hygiene is your first line of defense against infection. Question 14. What could be the consequence if a phlebotomy technician leaves the tourniquet on a patient's arm for longer than 1 minute? A. Hemolysis. B. Hemoconcentration. C. Petechiae. D. Both B and C. Answer: D. Both B and C. This question explores the adverse effects of prolonged tourniquet application. Leaving a tourniquet on for more than 1 minute can lead to hemoconcentration, where plasma fluid leaves the vein and enters the tissues, causing a temporary increase in the concentration of blood components like red blood cells and proteins. It can also cause petechiae, which are small red spots on the skin resulting from capillary bleeding due to increased pressure. For example, if a tourniquet is left on too long, the patient's skin might develop small red pinpoints, and their test results could be inaccurate due to concentrated blood. Always release the tourniquet promptly to avoid these complications. Question 15. A phlebotomy technician is asked to collect a stat blood specimen. What does stat indicate? A. The specimen needs to be collected within 24 hours. B. The specimen should be collected at the patient's convenience. C. The specimen requires immediate collection and testing. D. The specimen is for research purposes only. Answer: C. The specimen requires immediate collection and testing. This question assesses understanding of common medical abbreviations related to specimen priority. Stat is an abbreviation derived from the Latin word statum, meaning immediately. When a blood specimen order is marked stat, it signifies that the collection and subsequent testing must be performed with the highest priority and without delay due to the urgent medical need for the results. For example, a stat order might be for a patient in the emergency room experiencing chest pain, where quick results are needed to guide treatment. Always treat stat orders with the utmost urgency. Question 16. After performing a venipuncture, the phlebotomy technician accidentally sticks themselves with a contaminated needle. What is the immediate first action they should take? A. Notify their supervisor. B. Wash the needle stick site with soap and water. C. Apply a bandage to the site. D. Go to the emergency room immediately. Answer: B. Wash the needle stick site with soap and water. This question addresses the critical immediate response to a needle stick injury, which is a significant safety concern. The very first action after a needle stick exposure is to thoroughly wash the affected area with soap and water for several minutes to decontaminate the wound and reduce the risk of infection. Following this immediate cleaning, the technician should then report the incident to their supervisor and seek prompt medical evaluation. For example, quickly washing the wound helps to remove any potential pathogens from the puncture site. Always remember that immediate washing is the crucial first step for any needle stick. Question 17. Which of the following is an example of implied consent for a venipuncture procedure? A. The patient verbally agrees to the blood draw. B. The patient signs a consent form before the draw. C. The patient extends their arm when the phlebotomist approaches. D. The patient's guardian gives written permission. Answer: C. The patient extends their arm when the phlebotomist approaches. This question explores the concept of implied consent in the context of phlebotomy. Implied consent occurs when a patient's actions or nonverbal cues indicate their agreement to a procedure, even without a direct verbal or written statement. For example, when a phlebotomist explains the procedure and the patient then extends their arm for the blood draw, it signifies their implied consent. While verbal or written consent is always preferred and sometimes required, implied consent is accepted for routine procedures when the patient willingly presents their arm. Always confirm consent, whether verbal or implied, before proceeding with a draw. Question 18. What is the recommended depth for a heel puncture on an infant? A. No more than 1 mm. B. No more than 2.0 mm. C. No more than 3.0 mm. D. No more than 4.0 mm. Answer: B. no more than 2.0 millimeters. This question focuses on the safety parameters for capillary punctures on infants. The recommended maximum depth for a heel puncture on an infant is no more than 2.0 millimeters to prevent puncturing the calcaneus, heel bone, which can lead to osteomyelitis, bone infection, or other serious injury. Infant heel bones are very close to the skin surface, making precise depth crucial. For example, using a lancet designed specifically for infant heel sticks will ensure the correct depth. Always prioritize safety by adhering to the recommended puncture depth for infants. Question 19. A patient has a burn scar on their antecubital fossa. Which of the following alternative sites would be most appropriate for venipuncture? A. The antecubital fossa of the other arm. B. The dorsum of the hand. C. The leg or foot. D. Directly through the scar tissue. Answer: A. The antecubital fossa of the other arm. This question addresses alternative venipuncture sites when the preferred site is compromised. If one antecubital fossa, the bend of the elbow, is unsuitable due to scarring, burns, or other issues, the first and most appropriate alternative is to check the antecubital fossa of the other arm. These veins are generally larger, more superficial, and less prone to complications than hand or foot veins. For example, if a patient has a severe burn on their right arm, you would examine the left arm for a suitable venipuncture site first. Always prioritize the least compromised and most accessible veins, typically in the opposite arm. Question 20. Which of the following tests requires a blood specimen to be protected from light? A. Complete blood count, CBC. B. Basic metabolic panel, BMP. C. Bilirubin. D. Prothrombin time, PT. Answer: C. Bilirubin. This question tests knowledge of special specimen handling requirements. Bilirubin, a pigment produced from the breakdown of red blood cells, is highly sensitive to light and can degrade rapidly when exposed, leading to falsely decreased results. Therefore, blood specimens for bilirubin testing must be protected from light by wrapping the tube in aluminum foil or placing it in an amber-colored container immediately after collection. For example, if a neonate's bilirubin sample isn't protected from light, their jaundice levels might appear lower than they actually are. Always shield bilirubin samples from light to ensure accurate results. Question 21. What is the primary purpose of wearing gloves during venipuncture? A. To keep the patient's arm warm. B. To improve grip on the needle. C. To protect the phlebotomist and patient from infection. D. To prevent the blood from clotting. Answer: C. To protect the phlebotomist and patient from infection. This question focuses on the fundamental reason for wearing personal protective equipment, PPE, like gloves. Gloves act as a barrier to prevent the transmission of blood-borne pathogens and other infectious agents between the patient and the phlebotomist, protecting both parties. This is a core principle of standard precautions, where all bodily fluids are treated as potentially infectious. For example, wearing gloves prevents the phlebotomist from coming into direct contact with the patient's blood and vice versa. Always wear gloves during venipuncture to maintain a safe and sterile environment. Question 22. Which of the following is the best way to identify an unconscious and unidentified patient in an emergency room? A. Ask a family member to identify the patient. B. Check the patient's wristband against the requisition form. C. Ask the attending nurse for the patient's name. D. Use a temporary identification number and a three-part identification system. Answer: D. Use a temporary identification number and a three-part identification system. This question addresses patient identification in challenging emergency situations. For an unconscious and unidentified patient, it is crucial to use a temporary identification system to ensure accurate specimen labeling and patient safety. This typically involves assigning a temporary ID number, creating a three-part identification system, e.g., labels for the patient, the specimen, and the requisition form that links the patient to their samples until a permanent ID is established. For example, the patient might receive a temporary wristband with this number that matches labels applied to their blood tubes. Always ensure a robust identification system is in place for unidentified patients to prevent errors. Question 23. A phlebotomy technician is drawing blood from a patient with an IV line in their right arm. Which of the following is the most appropriate site for the blood draw? A. Distal to the IV site in the right arm. B. Proximal to the IV site in the right arm. C. The antecubital fossa of the left arm. D. The right wrist. Answer: C. The antecubital fossa of the left arm. This question addresses collecting blood from a patient with an IV line. The most appropriate site for drawing blood from a patient with an IV line is the opposite arm, contralateral arm, to avoid contamination of the blood sample with IV fluids, which can dilute the specimen and lead to inaccurate test results. Drawing from the same arm as the IV, even below it, risks contamination. For example, if a patient has an IV in their right forearm, you would choose a vein in their left antecubital area or hand. Always select the arm without an IV for accurate specimen collection. Question 24. What is the term for a small, pinpoint hemorrhage on the skin, often caused by a tourniquet being left on too long or by capillaries rupturing? A. Hematoma. B. Phlebitis. C. Petechiae. D. Ecchymosis. Answer: C. Petechiae. This question defines a specific type of skin lesion that can occur during venipuncture. Petechiae are small, pinpoint red or purple spots on the skin caused by minor hemorrhages from broken capillaries, often appearing when a tourniquet is applied too tightly or left on for too long, increasing capillary pressure. This differs from a hematoma, which is a larger collection of blood under the skin. For example, you might see tiny red dots on a patient's arm after releasing the tourniquet if it was on for too long. Recognizing petechiae is important as it indicates capillary fragility or excessive tourniquet time. Question 25. Which of the following needle gauges has the largest lumen opening? A. 23 gauge. B. 21 gauge. C. 20 gauge. D. 18 gauge. Answer: D. 18 gauge. This question tests knowledge of needle gauge sizing. In needle sizing, the gauge number is inversely proportional to the lumen, inner diameter, of the needle, meaning, the smaller the gauge number, the larger the needle's opening. Therefore, an 18 gauge needle has the largest lumen among the choices provided, while a 23 gauge needle would have the smallest. For example, an 18 gauge needle is often used for collecting blood for blood transfusions because it allows for rapid flow, whereas a 23 gauge is common for smaller, more fragile veins. Always remember that a smaller gauge number means a wider needle opening. Question 26. Which of the following is considered an acceptable site for venipuncture in an adult patient? A. A vein in the lower leg or foot. B. A vein located in the antecubital fossa. C. An artery in the wrist. D. A vein proximal to an active IV infusion. Answer: B. A vein located in the antecubital fossa. This question asks about appropriate venipuncture sites in adults. The antecubital fossa, the area at the bend of the elbow, is the preferred and most common site for venipuncture in adults due to the presence of large, easily accessible veins like the median cubital, cephalic, and basilic veins. These veins are superficial and well supported, making them ideal for blood collection. For example, the median cubital vein is usually the first choice because it is often the most prominent and least painful. Always prioritize the antecubital fossa for routine venipuncture. Question 27. How long should a phlebotomy technician typically scrub the collection site for a blood culture using an antiseptic? A. 5 to 10 seconds. B. 15 to 30 seconds. C. 30 to 60 seconds. D. 1 to 2 minutes. Answer: C. 30 to 60 seconds. This question focuses on the meticulous skin preparation required for blood culture collection, which is critical for preventing contamination. For blood cultures, the site must be thoroughly scrubbed with an appropriate antiseptic, like chlorhexidine or povidone iodine, for 30 to 60 seconds to ensure maximum disinfection and reduce the risk of false positive results from skin flora. This extended scrubbing time is essential to achieve a sterile field. For example, vigorously scrubbing for a full minute helps dislodge and kill more bacteria than a quick wipe. Proper skin preparation is paramount for accurate blood culture results. Question 28. What information must always be included on a collected blood specimen label? A. Patient's room number. B. Phlebotomist's full name. C. Patient's full name, date of birth, and date, time of collection. D. Patient's diagnosis. Answer: C. Patient's full name, date of birth, and date, time of collection. This question emphasizes the essential information required for proper specimen labeling to ensure patient safety and accurate testing. Every collected blood specimen label must include at least 2 unique patient identifiers, typically the patient's full name and date of birth, along with the date and time of collection, and the phlebotomist's initials. This precise labeling prevents misidentification and ensures the correct patient receives the correct results. For example, if a label only has a patient's last name, it could easily be confused with another patient. Accurate labeling is fundamental to preventing errors and maintaining specimen integrity. Question 29. Which of the following complications can occur if a phlebotomy technician punctures an artery instead of a vein? A. Hemolysis. B. Excessive bleeding and hematoma formation. C. Syncope. D. Nerve damage. Answer: B. Excessive bleeding and hematoma formation. This question addresses a serious complication of venipuncture, accidental arterial puncture. If an artery is punctured instead of a vein, the characteristic bright red, pulsating blood will alert the phlebotomist. Arterial blood is under much higher pressure than venous blood, leading to excessive bleeding and a greater risk of large hematoma formation, as well as potential nerve damage if nearby nerves are compromised. For example, an arterial puncture requires prolonged pressure application, typically 5 minutes or more, to stop the bleeding and prevent a significant bruise. Puncturing an artery is a serious error that requires immediate and prolonged pressure. Question 30. Which type of consent is required for a patient to undergo a potentially risky surgical procedure? A. Implied consent. B. Minor consent. C. Informed consent. D. Emergency consent. Answer: C. Informed consent. This question differentiates types of consent, focusing on procedures with inherent risks. Informed consent is a legal and ethical requirement for any medical procedure, especially those that are invasive or carry significant risks, such as surgery. It means the patient has received and understood all necessary information about the procedure, including its purpose, risks, benefits, and alternatives, and has voluntarily agreed to it, usually by signing a document. For example, before a patient undergoes an appendectomy, the surgeon must explain the procedure fully, and the patient must sign a consent form. Informed consent ensures the patient makes autonomous and knowledgeable decisions about their care. Question 31. A phlebotomy technician is drawing blood for a glucose tolerance test, GTT. After the fasting blood sample is collected, what should the patient do next? A. Eat a light meal. B. Drink a prescribed glucose solution. C. Exercise for 15 minutes. D. Lie down for an hour. Answer: B. Drink a prescribed glucose solution. This question describes a key step in performing a glucose tolerance test, GTT. After the initial fasting blood sample is collected, the patient is required to drink a precisely measured, prescribed glucose solution within a specific time frame, typically 5 minutes. This sugary drink provides the glucose challenge, and subsequent blood samples will be drawn at timed intervals, e.g., 1 hour, 2 hours, to measure how quickly the body processes the glucose. For example, the patient drinks a very sweet drink, and then blood samples are taken to see how their body handles sugar. Following the GTT protocol precisely is crucial for accurate diagnosis of conditions like diabetes. Question 32. Which of the following conditions is characterized by an abnormally low number of platelets? A. Anemia. B. Leukopenia. C. Thrombocytopenia. D. Polycythemia. Answer: C. Thrombocytopenia. This question tests basic medical terminology related to blood components. Thrombocytopenia is a medical condition characterized by an abnormally low number of platelets, thrombocytes, in the blood. Platelets are crucial for blood clotting, so a low count can lead to increased bleeding risk. Anemia is low red blood cells, leukopenia is low white blood cells, and polycythemia is high red blood cells. For example, a patient with thrombocytopenia might bruise very easily. Understanding these terms is essential for comprehending laboratory results and patient conditions. Question 33. Before performing a capillary puncture on an adult, what should the phlebotomy technician do to increase blood flow to the site? A. Apply ice to the finger. B. Warm the finger. C. Squeeze the finger vigorously. D. Place the arm above the head. Answer: B. Warm the finger. This question focuses on techniques to improve blood flow for capillary punctures. Warming the puncture site, typically by applying a warm, moist towel for 3 to 5 minutes or having the patient rub their hands together, helps to dilate the capillaries and increase blood flow to the area. Increased blood flow makes it easier to obtain a sufficient sample volume quickly and reduces the need for repeated punctures. For example, if a patient's hands are cold, warming them up first will help you get a good drop of blood. Always warm the site to ensure a good sample for capillary draws. Question 34. What is the minimum amount of time a phlebotomy technician should allow the antiseptic to dry on the skin before performing venipuncture? A. 5 to 10 seconds. B. 15 to 20 seconds. C. 30 to 60 seconds. D. It doesn't need to dry. Answer: C. 30 to 60 seconds. This question highlights the importance of proper antiseptic drying time for effective skin disinfection. For most antiseptics like isopropyl alcohol or chlorhexidine, allowing 30 to 60 seconds for the solution to air dry completely is crucial for its germicidal action to be effective. Puncturing the skin before the antiseptic is dry can also cause a burning sensation for the patient and contaminate the specimen. For example, if you wipe with alcohol and immediately stick, the alcohol hasn't had enough time to kill germs on the skin. Always allow the antiseptic to air dry completely to ensure effective disinfection and patient comfort. Question 35. A phlebotomy technician needs to collect a specimen for a coagulation panel, e.g., PT, PTT. Which tube color should be used? A. Red top. B. Green top. C. Light blue top. D. Yellow top. Answer: C. Light blue top. This question tests knowledge of specific tube types used for coagulation studies. The light blue top tube contains sodium citrate, an anticoagulant that specifically binds calcium, thus preventing blood clotting and preserving coagulation factors. This makes it the correct tube for tests like prothrombin time, PT, and activated partial thromboplastin time, aPTT, which assess the blood's clotting ability. For instance, if you used a different tube, the blood would clot, rendering it unsuitable for coagulation testing. Always remember the light blue tube is specifically for coagulation studies. Question 36. Which action would be most appropriate for a phlebotomy technician to take if a patient states they have a fear of needles, phobia? A. Tell the patient to tough it out. B. Dismiss their fear and proceed quickly. C. Explain the procedure calmly and offer coping strategies like deep breathing. D. Ask another technician to perform the draw without talking to the patient. Answer: C. Explain the procedure calmly and offer coping strategies like deep breathing. This question addresses professional and empathetic patient care, especially for those with needle phobia. A phlebotomy technician should acknowledge the patient's fear, maintain a calm and reassuring demeanor, and explain the procedure clearly while offering distraction or relaxation techniques, such as deep breathing or looking away. This approach helps to build trust, reduce anxiety, and improve the patient's experience. For example, you might suggest they close their eyes and count backward from 10 during the stick. Always communicate calmly and empathetically with anxious patients. Question 37. What is the primary reason for performing a dermal, capillary, puncture instead of a venipuncture on an infant? A. Veins are too deep in infants. B. To collect a larger blood volume. C. To minimize blood loss and preserve venous access. D. Capillary blood is more accurate for all tests. Answer: C. To minimize blood loss and preserve venous access. This question focuses on the rationale for choosing capillary puncture over venipuncture in infants. Performing a dermal puncture on infants is preferred because it minimizes the total blood volume drawn, which is crucial for preventing iatrogenic anemia, anemia caused by medical treatment, and it preserves the more critical and limited venous access sites for future medical needs like IVs or transfusions. For instance, repeatedly drawing large volumes of blood from an infant's veins can deplete their blood volume over time. Capillary punctures are safer and less invasive for infants when small blood volumes are needed. Question 38. A phlebotomy technician is preparing to draw blood from a patient who is unconscious. What type of consent is applicable in this situation? A. Expressed consent. B. Implied consent. C. Informed consent. D. Emergency consent. Answer: D. Emergency consent. This question addresses consent in an emergency context. When a patient is unconscious or otherwise unable to give consent and a medical procedure is immediately necessary to save their life or prevent serious harm, emergency consent is implied by law. This allows healthcare providers to act without obtaining explicit consent, assuming the patient would consent if they were able. For example, if an accident victim is unconscious and bleeding profusely, doctors would treat them immediately without waiting for them to regain consciousness to provide consent. In emergencies, the focus is on immediate, life-saving care. Question 39. Which of the following actions should be avoided when selecting a venipuncture site? A. Palpating for a vein with a gloved finger. B. Using the same vein from a previous failed attempt. C. Assessing both arms before selecting a site. D. Warming the site to increase blood flow. Answer: B. Using the same vein from a previous failed attempt. This question identifies an action that should be avoided during site selection to prevent complications. Reattempting a venipuncture in the exact same vein immediately after a failed attempt is generally discouraged because the vein may have collapsed, developed a hematoma, or become compromised, making a second successful stick unlikely and increasing patient discomfort and bruising. It's better to choose a different vein, either in the same arm or the opposite arm. For example, if you miss a vein in the right antecubital area, you should try a different vein in the left antecubital or hand. Always seek a fresh, uncompromised site for subsequent attempts. Question 40. A phlebotomy technician is explaining the venipuncture procedure to a patient. Which of the following terms should the technician use to describe the process in a patient-friendly manner? A. I will be performing a venipuncture. B. I will be taking blood from your vein. C. I will be accessing your circulatory system. D. I will be inserting a needle for specimen collection. Answer: B. I will be taking blood from your vein. This question emphasizes the importance of clear, patient-friendly communication. When explaining a procedure to a patient, it is crucial to use simple, non-medical language that they can easily understand, rather than complex anatomical or technical terms. Taking blood from your vein is a straightforward and widely understood phrase, reducing patient anxiety and improving comprehension. For example, instead of saying accessing the lumen of your median cubital, you would simply say, I'm going to take some blood from your arm. Always speak clearly and simply when explaining procedures to patients. Question 41. What is the common term for a condition in which the body's immune system attacks its own tissues? A. Infection. B. Inflammation. C. Autoimmune disease. D. Allergic reaction. Answer: C. Autoimmune disease. This question assesses basic knowledge of a common medical condition. An autoimmune disease is a condition where the body's immune system mistakenly attacks its own healthy cells, tissues, and organs, identifying them as foreign invaders. Examples include rheumatoid arthritis, lupus, and multiple sclerosis. This is distinct from infections, caused by external pathogens, inflammation, the body's response to injury or infection, or allergic reactions, hypersensitive response to external substances. For example, in type 1 diabetes, the immune system attacks the insulin-producing cells in the pancreas. Understanding autoimmune conditions helps phlebotomists recognize potential challenges or considerations during blood draws. Question 42. Which of the following is an example of an unethical practice in phlebotomy? A. Double-checking patient identification before a draw. B. Performing a draw on a patient who refused consent. C. Explaining the procedure to the patient. D. Disposing of sharps in a biohazard container. Answer: B. Performing a draw on a patient who refused consent. This question addresses ethical principles in healthcare, particularly regarding patient autonomy. Performing a blood draw on a patient who has explicitly refused consent is a direct violation of their rights and constitutes assault and battery, regardless of the medical necessity. Respecting a patient's right to refuse treatment is a fundamental ethical principle. For example, if a patient says no to the blood draw, you must stop, even if the doctor ordered it, and inform the nurse. Always uphold patient autonomy and respect their right to refuse care. Question 43. What is the correct way to dispose of a contaminated needle after venipuncture? A. Recap the needle and place it in a regular trash can. B. Break the needle off and discard it in a biohazard bag. C. Immediately activate the safety mechanism and dispose of the entire needle/holder unit into an approved sharps container. D. Place the uncapped needle on the tray for later disposal. Answer: C. Immediately activate the safety mechanism and dispose of the entire needle/holder unit into an approved sharps container. This question highlights a critical aspect of sharps safety and infection control. After venipuncture, the phlebotomy technician must immediately activate the needle's safety mechanism and dispose of the entire needle and adapter assembly as a single unit into an OSHA-approved, puncture-resistant sharps container. Recapping or breaking needles is extremely dangerous and strictly prohibited as it increases the risk of needle stick injuries. For example, after withdrawing the needle, you would slide the safety cover over it and then drop it directly into the sharps bin. Always prioritize sharps safety by using safety devices and disposing of needles properly and immediately. Question 44. A phlebotomy technician encounters a rolling vein during venipuncture. What is the best technique to minimize this problem? A. Use a smaller needle size. B. Apply less tourniquet pressure. C. Anchor the vein firmly with the thumb of the non-dominant hand. D. Attempt to draw blood from a different arm immediately. Answer: C. Anchor the vein firmly with the thumb of the non-dominant hand. This question addresses a common challenge in venipuncture: rolling veins. A rolling vein is a vein that moves away from the needle when punctured. The best technique to prevent this is to firmly anchor the vein by pulling the skin taut directly below the puncture site with the thumb of the non-dominant hand. This stabilizes the vein and prevents it from rolling, increasing the likelihood of a successful venipuncture. For example, before inserting the needle, you would use your thumb to pull the skin downward, holding the vein in place. Always anchor veins properly to ensure a stable target. Question 45. Which of the following refers to the destruction of red blood cells, which can lead to inaccurate test results? A. Hemostasis. B. Hemoconcentration. C. Hemolysis. D. Hematoma. Answer: C. Hemolysis. This question defines a critical issue in specimen integrity. Hemolysis is the rupture or destruction of red blood cells, which causes hemoglobin to be released into the plasma or serum, making the specimen appear pink or red. This can lead to inaccurate test results for many analytes, as intracellular components interfere with chemical assays. Common causes include vigorous shaking of tubes, drawing blood through a hematoma, or using too small a needle. For example, a hemolyzed sample would be rejected for a potassium test because red blood cells contain high levels of potassium, falsely elevating the result. Preventing hemolysis is essential for accurate lab results. Question 46. A phlebotomy technician is preparing to draw blood from a patient for a fasting blood glucose test. What is the minimum fasting period required for this test? A. 2 hours. B. 4 hours. C. 8 hours. D. 12 hours. Answer: C. 8 hours. This question assesses knowledge of pre-analytical requirements for specific lab tests. For a fasting blood glucose test, the patient must fast for at least 8 to 12 hours prior to the blood collection, meaning no food or drink except water. This fasting period ensures that the blood glucose level reflects the body's baseline state without recent dietary influence, providing accurate results for diagnosing conditions like diabetes. For example, if a patient eats breakfast before the test, their glucose reading will be falsely elevated. Always confirm the fasting status for glucose tests. Question 47. Which government agency enforces regulations to protect patient privacy and confidentiality, especially regarding protected health information, petechiae? A. OSHA. B. CLSI. C. HIPAA. D. FDA. Answer: C. HIPAA. This question addresses patient privacy regulations in healthcare. HIPAA, the Health Insurance Portability and Accountability Act, is a federal law that establishes national standards to protect sensitive patient health information, petechiae, from being disclosed without the patient's consent or knowledge. It mandates strict rules for the handling, storage, and transmission of patient data to ensure confidentiality. For example, under HIPAA, you cannot discuss a patient's lab results with unauthorized family members. Always adhere to HIPAA guidelines to protect patient privacy. Question 48. After collecting a blood specimen for a blood alcohol content (BAC) test, which antiseptic should not be used to clean the venipuncture site? A. Isopropyl alcohol. B. Povidone iodine. C. Chlorhexidine gluconate. D. Benzalkonium chloride. Answer: A. Isopropyl alcohol. This question addresses a specific consideration for blood alcohol content (BAC) testing. Isopropyl alcohol should never be used as an antiseptic for BAC testing because it contains alcohol, which could falsely elevate the patient's blood alcohol level, compromising the accuracy and legal validity of the test result. Instead, non-alcohol-based antiseptics like povidone iodine, betadine, or chlorhexidine gluconate should be used for site preparation. For example, using an iodine swab ensures that no external alcohol contaminates the sample. Always use an alcohol-free antiseptic for blood alcohol draws. Question 49. Which of the following tubes contains an anticoagulant that inhibits thrombin? A. Red top. B. Light blue top. C. Green top. D. Gray top. Answer: C. Green top. This question tests knowledge of anticoagulants found in specific blood collection tubes. The green top tube contains heparin, lithium heparin, sodium heparin, or ammonium heparin, which acts as an anticoagulant by inhibiting thrombin, an enzyme essential for fibrin clot formation. This allows for rapid turnaround times for plasma chemistry tests because the blood does not need to clot first. For example, a stat chemistry panel might use a green top tube to get results quickly. Remember that green tubes contain heparin, which directly stops clotting by inhibiting thrombin. Question 50. A patient has fragile, easily collapsible veins. Which type of needle/collection system would be most appropriate for this patient? A. 18-gauge needle with an evacuated tube system. B. 21-gauge needle with a syringe. C. 23-gauge butterfly, winged infusion, set with a syringe. D. 20-gauge needle with a large volume evacuated tube. Answer: C. 23-gauge butterfly, winged infusion, set with a syringe. This question addresses adapting venipuncture techniques for patients with challenging veins. For patients with fragile or easily collapsible veins, a smaller gauge needle, like a 23-gauge, paired with a butterfly, winged infusion, set and a syringe is often the most appropriate choice. The smaller needle minimizes trauma to the vein, and the syringe allows for manual, controlled aspiration of blood, which reduces the vacuum pressure that can collapse fragile veins, unlike the strong vacuum of an evacuated tube system. For example, when drawing blood from an elderly patient with delicate veins, a butterfly and syringe offer the best chance of success. Always choose methods that protect fragile veins to ensure a successful draw.